Hey, Alpha Nurses, I'm Nurse Sandra from alphanursguide.com. This is the NCLEX PN Review Lesson 36, Nursing Fundamental Questions. You can get my notes on Etsy. Be sure to follow my store to get any updates on new notes. You can follow me on Facebook, Instagram, and TikTok to get any updates. All links are in the description. Without the way, let's get started.
Question 1. The nurse employed in a long-term care facility calls the healthcare provider regarding a new medication prescription because the dose prescribed is higher than the recommended dosage. The nurse is unable to locate the HCP, and the medication is due to be administered. Which action should the nurse take? A. Contact the nursing supervisor. B. Administer the dose prescribed. C. Hold the medication until the HCP can be contacted. D. Administer the recommended dose but continue to locate the HCP. The correct answer is A. Contact the nursing supervisor. Rationale: if the HCP writes a prescription that requires clarification, it is the nurse's responsibility to contact the HCP for clarification. If there is no resolution regarding the prescription, because the HCP cannot be located, or because the prescription remains as it was written after talking with the HCP, the nurse should then contact the nurse manager or supervisor for further clarification as to what the next step should be. Under no circumstances should the nurse proceed to carry out the prescription until clarification has been obtained. Question 2. The nurse is assisting in reviewing the critical paths of the clients on the nursing unit. In performing a variance analysis, which indicates the need for further action and analysis. A. Clear breath sounds in a client with heart failure. B. A postoperative client who develops a cough and a fever. C. The absence of a wound infection in a client who had a coronary artery bypass graft. D. A client with diabetes mellitus demonstrating accurate use of a glucometer after teaching. The correct answer is B. A postoperative client who develops a cough and a fever. Rationale: variances are actual deviations or detours from the critical paths. Variances can be positive or negative, avoidable or unavoidable, and can be caused by a variety of factors. Positive variance occurs when the client achieves maximum benefit and is discharged earlier than anticipated. Negative variance occurs when untoward events prevent a timely discharge. A postoperative client who develops a cough and a fever identifies a negative outcome. Question 3. A nursing student is planning care for a client with paraplegia, who is at risk for injury because of spasticity of his leg muscles. The nurse intervenes if the student plans to include which intervention to minimize the risk of injury to the client. A. Use of padded restraints to immobilize the limb. B. Performing range of motion to the affected limbs. C. Removing potentially harmful objects near the spastic limbs. D. Use of as-needed prescriptions for muscle relaxants, such as baclofen. The correct answer is A. Use of padded restraints to immobilize the limb. Rationale: range of motion exercises are beneficial in stretching muscles, which may diminish spasticity. Removing potentially harmful objects is an important safety measure. Use of muscle relaxants also is indicated if the spasms cause discomfort to the client or pose a risk to the client's safety. Use of limb restraints will not alleviate spasticity and could harm the client. Question 4. A client was involuntarily admitted to the psychiatric unit because of episodes of extremely violent behavior. The client is demanding to be discharged from the hospital. The nurse reports the information to the charge nurse, and the charge nurse does not allow the client to leave. The nurse understands that, which represents the legal ramifications associated with the charge nurse's behavior. A. The charge nurse will be charged with assault. B. The charge nurse will be charged with slander. C. The charge nurse will be charged with imprisonment. D. No charge will be made against the charge nurse because the charge nurse's actions are reasonable. The correct answer is D. No charge will be made against the charge nurse because the charge nurse's actions are reasonable. Rationale: False imprisonment is an act with the intent to confine a person to a specific area. The nurse can be charged with false imprisonment if the nurse prohibits a client from leaving the hospital, if the client was voluntarily admitted, and if there are no agency or legal policies for detaining the client. On the other hand, if the client has been involuntarily admitted or has agreed to an evaluation before discharge, the nurse's actions are reasonable. Question 5. The nurse observes an outburst by a client with a history of schizophrenia, during which the client uses extreme foul language. Which appropriate documentation should the nurse make for this occurrence? A. Document that the client is swearing loudly. B. Document that the client is having an outburst. C. Use quotation marks placing dashes and lines in the place of the profane words. D. Use quotation marks, exact words and additional objective information about effect and nonverbal behavior. The correct answer is D. Use quotation marks, exact words and additional objective information about effect and nonverbal behavior. Rationale: Option D provides accurate, legally defensible information regarding the client's behavior. Options A and B are not objective. Option C is incomplete documentation and is not legally defensible. Question 6. Emergency surgery is scheduled for a client with a bowel obstruction. The nurse tells the charge nurse that she is unable to obtain informed consent from the client because the client has received opioid analgesics and is sedated. The nurse understands that which action should be implemented. A. Performing the surgery without an informed consent. B. Having the client sign the consent form, because this is an emergency situation. C. Calling the family and telling them that they must come to the hospital to sign the informed consent. D. Obtaining a telephone consent from the family member and ensuring that the oral consent is witnessed by two persons. The correct answer is D. Obtaining a telephone consent from the family member and ensuring that the oral consent is witnessed by two persons. Rationale: Every effort must be made to obtain permission from a responsible family member to perform surgery if the client is unable to sign the consent form. Telephone consent must be witnessed by two persons who hear the family member's oral consent. The two witnesses then sign the consent and document the name of the family member, noting that an oral consent was obtained. In emergencies, the client may be unable to sign, and family members may not be available. In this type of a situation, the healthcare provider is legally permitted to perform surgery without consent. Consent is not informed if it is obtained from the client, who is confused, unconscious, mentally incompetent, or under the influence of sedatives.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.